Hello, Dr. Lustbader. Welcome back to On Topic Medical, where we address a lot of different topics of interest to caregivers and families. And today specifically, we will be discussing how we take precautions to help the families know what to do in a crisis with an older parent and or someone that is ill. And so we were talking about having possibly a folder. And in this folder, it has to address a lot of really important details. And what do you think should be in that folder if you were to make one yourself?
So certainly, we have aging family members, parents, so forth, that may be living alone. They may have a spouse. They may be caring for a spouse. Kids may be close by, or they may be across the country. So it is very helpful to have a folder that's quite visible, labeled as important documents or medical history.
For mom and for dad.
Yeah, or any relative, that you may be, caring for. And some of the topics in there really should be what's their medical history, what medications are on, what supplements they're on. Often patients forget what they're taking, or they may be taking unusual supplements, over-the-counter things, or not just vitamins, but nutraceuticals, or a whole host of things are available online these days. And it's important to know that because that can interfere with other medications or things that we may use in the hospital. Certainly allergy is very important. You don't want to give someone penicillin if they're allergic to penicillin.
Maybe make them a bracelet, possibly, for
Certainly very good to do. It's also important to have them plugged into a steady healthcare provider, a primary care doctor, or a general internist, or someone who will be the captain of their ship to coordinate, but they're not always available. It could be in the middle of the night, it could be on a weekend. So if emergency services has to come to the patient, or they have to be brought to a hospital.
Take out that folder.
If you have that folder with you. So who are the doctors? Who are the people who know the patient? Who are the emergency contacts, and in what order to reach them? What's their insurance? What's their primary insurance or secondary insurance? Do they have a healthcare proxy? Should they have a healthcare proxy? Family members, and certainly the doctor, should say, if you're not able to make decisions, who do you want to make decisions for you if you're incapacitated? Could be a relative, could be a friend.
What is this healthcare proxy? I mean, a lot of people, I think, have a hard time understanding so many forms and where do they get one.
Right. So people often confuse, what's a living will, what's a healthcare proxy. So a living will is really an understanding of how aggressive you want your care to be. In other words, if I am very sick, do I want to go to an ICU? Do I want just comfort care? Make me comfortable. I do not want to be resuscitated, DNR. I do not want a breathing tube, DNI. Do not intubate. Or maybe some people want that. Some people have issues with blood transfusion, or give me all the antibiotics, depending on the religion. So it's important to outline that really in sort of a living will. But the proxy says, if I cannot make decisions, who will make it for me? Some children anticipate, well, it'll be the oldest child or the spouse. And of course, there is a hierarchy that's used, but if the patient outlines someone specifically, could even be a friend and not a family member, someone who they trust and who understands their wishes as to how aggressive
So it should be talked about while the parents are still
That's the key thing, important conversations. So, and it doesn't have to be all settled in one conversation, but to have an ongoing dialogue with the goal of saying, let me understand what your wishes are, how aggressive to be. Some of it depends on the diagnosis. They may be perfectly healthy and say do everything, or they may have a bad diagnosis, cancer, metastatic cancer. And if it's a bad prognosis, there may be a discussion sometimes with the doctor as well, how aggressive really should we be. So it's important to have that DNR form if they don't want to be resuscitated, recent hospitalizations, what hospital they may want to go to, although if it's an emergency,
they might take
if they can.
Closer.
And certainly, passwords, passcodes to, important information, bank accounts and so forth, and to, make a determination of can they manage their own affairs or not. So this is a lot of information. It can be overwhelming, and it's important to have a series of conversations so patients do not feel like, are you having this conversation because I'm dying next week? Do you know something I don't?
You don't want them
but
to
really,
feel that.
exactly. But to say, let's plan ahead so that in the event of a problem, and this could be years before any problem, for doctors it's helpful because there are reimbursement codes for discussing some of these things.
Oh, really?
But it's really important for family, people who care about that individual, to have
so a
these
doctor
sort
can
of
have this
discussions.
conversation also kind of bring it up so it may not feel like too weird for a kid to, ask their parents. The doctor might say, what would you like? Do you want intubation? Do you want to be resuscitated? Do you want to be kept alive at all costs? Or are you into comfort? Do you want to be in the ICU?
The conversation can start with family or with the doctor, but ultimately family and friends needs to get that folder. The doctor is not going to assemble the passcodes and assemble all the
Because the
information.
phone holds a lot of information. All their doctors.
It could be
so
access
you want
to
to
the
have
phone.
the password.
For sure.
Yeah, it's so interesting. And so if you like I know we're discussing this topic, so if you had to say the most important thing to address when a new family member has a severe illness, the main thing that they have to do is this folder, and what else? This conversation?
Well, as part of the folder, before the folder, it really is a conversation to say, Mom or Dad, Uncle, cousins, we're worried about you. We would like to do some planning. We want to understand your wishes. You're elderly. You have a lot of medications. You may not have an elevator. You're living alone. If there are further problems, we'd like to get this information. Are you open to that?
Do you want it their way?
To do it their way so they feel in control. Do you want to do it with a doctor? Do you want to just do it with us? Can we review it with your doctor? Who is your doctor? Where do you go? So it's important to try to get as much information and buy-in from everybody so that in the event of a sudden problem or worsening, at least there's a basic game plan.
And I know that there's a special form, I believe it's pink, that you put on the refrigerator. You should have it in the house.
In New York State, that's a MOLST form, or Medical Orders for Life-Sustaining Treatment. Basically, when emergency services breaks down your door, they see on the refrigerator a bright form,
It
pink
tells them
form
what
that says
direction
this patient should not be resuscitated or intubated, because without other information, they would be very aggressive. If there's hope, they would potentially put the patient on a breathing machine, which may be appropriate for some patients and not appropriate for others.
Like if they're supposed to pass away soon, if they're very, very ill,
Make it
then maybe
comfortable.
why sustain their
Some get
suffering?
home hospice. All of this should be discussed and interacted with the patient, the family, forms filled out, and it really takes advanced care planning.
And one last question I'm actually very curious is if there's a parent that wants hospice at home, how soon should they take care of the hospice situation so it's not surprised and brought on them and then it's too late and they're dying in the hospital? If they really want to be home, would you say a week, 2 weeks, a month in advance that they call hospice?
That's a conversation again, with the doctor and home hospice. But basically, anyone who has a prognosis that they may pass away within 6 months, you could certainly get hospice. If they live longer, you can renew that. But the worst thing would be for someone, a day before you realize, oh my gosh, because for patients who don't want to be resuscitated, there are comfort kits, morphine, and other things that can make the patient comfortable. If they really have an irreversible prognosis or poor prognosis, they should be able to die at home in a comfortable way. So all of these things need to be thought about in advance, planned in advance, if possible.
I learned the hard way with my mom, and I want everybody to know I waited. I didn't realize how fast it would happen, and there wasn't enough time to set up hospice in the house. So she didn't die at home. She ended up dying in the hospital. But I want everybody to learn from that. And thank you so much, Dr. Lesbader, for again enlightening us.
Pleasure.
Thank you.